I'm Dr. Ira Bernstein. What I'd like to talk to you today is a life-changing experience concerning my own health that has changed A, how I feel, and B, how I practice medicine. First, a little bit about me. I'm a family physician. I've been practicing in Toronto since 1992. I'm lecturer, Department of Family and Community Medicine, University of Toronto, where I do teach medical students here in my office. I'm also on active staff, Department of Family and Community Medicine at Humber River Hospital in Toronto. In addition, I'm the family physician division head for mental health at Humber Hospital, where I look after a team of physicians and we take care of the mental health inpatients in the hospital. First, what I'd like to talk to you about now is that most physicians typically have not been proactive with regards to comprehensive nutritional supplementation. My medical students have confirmed that they receive approximately 3 to 4 hours of nutritional education in their entire medical career. They don't receive any supplementation recommendation per se, with the exception of perhaps some calcium and vitamin D with regards to osteoporosis, and folic acid for prenatal care. Typically, physicians would recommend individual vitamins based on measured deficiencies, such as vitamin D, where many physicians are on board, as well as vitamin B12. So these would be measured when they send their patients to the lab and their tests are indicating deficiencies. Otherwise, typically, physicians would recommend either nothing at all, they're not aware of the evidence, they'll tell their patients just to eat well. Or they may just recommend a mass-market, off-the-shelf, one-a-day vitamin at your local drugstore. Most physicians do not understand the differences between products. Or physicians may just simply hand out office samples to their patients with a typical one-a-day product, such as Centrum, #1 doctor recommended. What happened? What changed my perception of all of this since I was one of these typical physicians? This all happened on March 14, 2011, which I would describe as my personal health 9/11. Prior to March 14, 2011, everything was pretty much normal. I exercised about twice a week. My diet was reasonable. It was balanced. I did certainly have a lot of stress, plenty of it within my own practice. However, nothing was out of the ordinary. However, that all changed that Monday morning. So what happened when I woke up that day? All of a sudden, my balance was off. I had what would be described as brain fog. Then episodes of vertigo began. This would be described as true spins. They were clockwise in rotation. In addition, there was visual disturbance. I would have unequal focusing of the vision in my left eye. One of the other symptoms that developed was tinnitus. It would be ringing in the ear. So what did I think I had? First, I thought it was a viral infection called labyrinthitis. However, the symptoms did not go away. Because they didn't go away, I then thought I had a brain tumor. As a result, I arranged to have an MRI of my brain. It was fortunately normal. I then did arrange an ear, nose, and throat consultation for further evaluation. I saw the doctor, and after examination and testing, he did discover that I had some mild low-frequency hearing loss in my left ear, and he thought that I had a condition called Meniere's disease. He sent me for some additional investigations. In Toronto, I went for testing called ENG. This tests your inner ear function, as well as caloric testing, where water would be sent flushed through your ears and you examine the eye responses. Most of these tests were pretty much normal. Afterwards, I saw him and he recommended a low-salt diet and a medication called beta-histine, also known as Circ. And these are typically recommended for patients who have Meniere's disease. So what did I think? I thought first, like, wow, how could this happen? How me? Why me? In my own practice, Meniere's was fairly infrequent. So what did I know about this condition? What was the cause? What is the cure? Is there a cure? And are there other treatments available? First, how I felt and what I did. I did take the Circ, the beta-histine, took it regularly. In addition, I started researching the internet for other solutions. Some patients have called me Dr. Google. I think this would be accurate. However, it is quite helpful in terms of finding out additional information. I did come across a very informative website, www.menieres-disease.ca. This was hosted by a now retired registered nurse by the name of Karen Henderson, who lives in British Columbia. I contacted Karen, and we had a discussion, and typically conventional treatments would focus on symptoms, not the underlying cause of Meniere's. It is an inflammatory disorder, but the cause is unknown. Karen has been assisting Meniere sufferers for over 10 years with nutritional support after her husband was diagnosed with this very debilitating condition. Now, what were my thoughts? I was quite skeptical. I thought, vitamins for Meniere's disease? You've got to be kidding. This would be a typical physician feeling. However, I was not feeling well. I was having horrendous vestibular symptoms. I could not walk a straight line. I was practically collapsing. Some days I was completely confined to bed. Exercise was completely impossible. This was affecting my work in a significant way. My performance was reduced, and I was prepared to take a disability leave. I was actually feeling sicker than most of my patients. My ability to be empathic diminished since I was feeling so unwell. I had been taking the circ for almost 3 weeks, and unfortunately the vertigo recurred. So I contacted Karen again regarding the supplements. I was sick now for over 2 months, and I said, I need to do something different. I was feeling unwell 24/7 with no relief in sight. Karen had recommended supplements. They were from a company called USANA. USANA, who are they? I never heard of them before, even though they had been around for approximately 20 years. I only knew Centrum. So what were the nutritional recommendations that were recommended by Karen for Meniere's? First were the USANA Essentials. These are the multi-minerals and mega antioxidants. Proflavanol C100. This is purified grapeseed extract combined with vitamin C. Ginkgo PS, Ginkgo biloba, for brain support, and active calcium. So this is calcium, magnesium, and other nutrients. I started taking the nutritionals continuously, and after approximately 6 weeks, I had my first break in symptoms. This is the first time I was feeling well. This lasted for about 2 weeks. However, the cycles would repeat. However, what I would find over time is that subsequent relapses would be less severe, and the brain fog that I was experiencing would be less. What I found over time is that I had more sustained improvement in my health over a 6 to 7 month period. I felt at that point I was getting my life back, and I felt it was due to the nutritionals. For the first time, I was able to go back to the gym, and I resumed my running again. I continued to have improvement over time. I subsequently added additional nutritionals to my regimen. Biomega, which is fish oil, Palmetto Plus for prostate health, and coenzyme Q10, the coquinone 100. So currently, it is now just over 3 years since my symptoms all began. I did set goals for myself. I wanted a better quality of life. I was determined to get my life back. Back in 2012, a friend of mine spoke to me, and he had suggested, since I had done some running, he says, why don't you register for the Scotiabank Half Marathon in Toronto? I thought, are you kidding? I'd never run a half marathon before. I'd only done some 10-kilometer runs before, and even that was a challenge. However, I decided I'm going to take the challenge and do the run. And sure enough, on October 12th, I completed my first half marathon. This was a major accomplishment for me. So, how am I today, 2014, with my Meniere's? Is it a cure? No. Nutritionals are not a cure for Meniere's, or any disease for that matter. However, I don't get vertigo anymore, and most of the time I'm feeling 100%. I may get some periodic vestibular symptoms, but I have my life back. I have to be very cautious regarding certain triggers that may potentially worsen or bring on some symptoms, this could include sleep deprivation or even chemicals in food. I do never leave home without my proflavanol, since this is the most important antioxidant that truly gives symptomatic relief. As a result of my own health experience, I realized that there was a very significant knowledge gap as a physician. I had been practicing 19 years as a family physician at that time with absolutely no knowledge of cellular nutrition. I needed to learn more. So, fortunately in Toronto, there is a course that was offered for a physician called Nutrition for Docs. Part 1 and Part 2. I registered for these courses. These are the evidence-based role of nutrition and supplementation. These courses were conducted by Dr. Aileen Burford Mason. She wrote a book called Eat Well, Age Better, evidence-based medicine for applying nutritionals. As a result, I've incorporated this now into my practice, and I'm pleased to help share that with patients and others. In an upcoming video, I'm going to discuss some of my experience with my knowledge of cellular nutrition, why we should be incorporating nutritionals into all of our lives, and how we can all benefit from it. Thank you for watching.